The objective here is to describe the etiology, identification, and therapy for cirrhosis. Cirrhosis is defined as a diffuse disorganization of normal hepatic structure by extensive fibrosis associated with regenerative nodules. If you look at the picture here in the first slide, you can see a cirrhotic liver compared to a normal liver. If you look at the cirrhotic liver, you can see the nodules as described in the definition, as well as you can see the fibrotic scarring. It is the fibrotic scarring that occurs in the liver that causes a cirrhotic liver to shrink in size and become smaller than a normal liver. In rare cases, such as cirrhosis due to long-term alcohol abuse, the liver will actually get larger than a normal liver, and then it will shrink in size. If you have a small cirrhotic liver that eventually enlarges, that is a red flag for a tumor occurring in that liver. Once again, we can look back at the picture here on the first slide, and you can see that these nodules are different sizes. Now, these nodules can be classified as either macronodular or micronodular, depending on their size. If it's micronodular, it will be smaller than 5 millimeters. If they're macronodular, they'll be greater than 5 millimeters. Now, with cirrhosis, it is caused by long-term liver diseases, such as diseases caused by, such as hepatitis caused by HCV, HBV, or as well as long-term alcohol abuse. We will cover more of these etiologies in the next slide. Now, as I mentioned earlier in the previous slide, that cirrhosis is the final stage due to chronic liver disease. You can see in the list here that there are a number of diseases that can cause cirrhosis. The most common tends to be alcohol abuse as well as hepatitis C. Now, the list shows a number of other diseases that lead to cirrhosis, and the best way to remember them is to think of your A, B, and C. It's a bit of a mnemonic. So A representing autoimmune hepatitis, B, hepatitis B, C, hepatitis C, and D for drugs. And then you can keep following down. But a good way to remember what causes cirrhosis, just think anything that is a chronic liver disease and stays in the patient for a long period of time is going to lead to a cirrhotic liver. Now, for clinical presentations of cirrhosis, I like to think of the cardinal signs that appear with any liver problem. For the most part, if you have a liver disease, you're always going to present with jaundice and scleral icterus, which is the yellowing of the skin as well as the yellowing of the eye as well. Now, what kind of stands out with cirrhosis is if someone comes in and presenting with ascites, which is a large protruding abdomen due to fluid building up in the abdominal cavity. In the later stages of cirrhosis, you'll see people suffer from portal hypertension. This is manifested by seeing protruding veins around the umbilicus area. Now, if cirrhosis is due to a tumor, or if there is a tumor presented in a cirrhotic liver, usually the patients will present with weight loss. And you can read through the rest of the slide to pick up some other clinical presentations that can occur with a person who has a cirrhotic liver. We're now going to take a look at the lab biologies you can find when looking at cirrhotic livers. Now, liver disease can be caused by, like we said earlier, by a number of different diseases. And these lab values and the ratios compared to each other allow us to pinpoint to what disease led to a cirrhotic liver. So if you get the lab values and you're looking at your AST and ALT, and your AST is 2 times higher than your ALT, plus you have a high GGT, you know that you have developed cirrhosis due to chronic alcohol abuse. Now, if your ALT, however, is higher than your AST, then the cirrhosis has been caused by a viral infection, or you're having liver disease due to a viral infection. Now, with most liver problems or liver diseases, you can find a high bilirubin. Bilirubin is a great indicator that there is something going wrong with the liver or with the anatomical parts around the liver, such as the gallbladder and sometimes the pancreas. So it kind of narrows your field as to what you're looking at, but it doesn't really pinpoint it down to exactly what's causing a liver problem. It just allows you to know that there's something going on with the liver and you need to take a look at it. The best function, or the best test to do, is your liver function test. These tests give you an overall understanding of what exactly is going on in the liver, and the LFT should be the diagnosis you should order. To also help out, rule out any other causes of cirrhosis, or to confirm your causes of cirrhosis, you can do several images, well, a couple of images. You can do an ultrasound, which allows you to see if there's any gallstones. It also allows you to see if there's any common bile duct obstruction. The CT scan is good to see if there's any liver or pancreatic masses. Allows you to see any varices, as well as to see if there's any splenomegalia. The ERCP is another one to see if there's any common bile duct obstruction or stones. And a liver biopsy, which is the gold standard. They'll go in and they'll take liver tissue and they'll send it into a pathologist, and the pathologist will confirm that the liver is cirrhotic. Now, your treatment for cirrhosis is very limited. Since it is the final stage of a chronic liver disease, it is irreversible. The main thing that they can do for a person with cirrhosis is a liver transplant. If not, the person will eventually die from the disease. What they can do, the main thing is avoidance. If you already have a liver problems, avoiding certain hepatotoxins such as alcohol, acetaminophen, as well as any drug that can go through the liver to cause it to be overworked, and improve your nutrition. But like I said, the main treatment you can have is receiving a new liver, having a liver transplant. So this is all for our objectives of covering cirrhosis. Hope you got the information you need, and that is it. Thank you.